Kidney stones are known to be painful, but did you know there's a specific type of stone that can be deadly? Yes, you heard me right. One of the calcium phosphate stone types has a 41% survival rate over a 15-year period. Now, that's nearly a 50-50 chance of death. If that doesn't scare you, it absolutely should, because these stones are on the rise. So stick around for this video to learn more about the stone type and what you can do to protect yourself. Hi, I'm Joey Weichman, and welcome to Stone Relief. Over the last decade, I've been blessed with the opportunity to work with thousands of you suffering from kidney stones, just like I did. And bar none, those of you suffering from Struvite kidney stones are some of my most memorable and heartbreaking stories. Struvite stones are the most nasty and dangerous stones that can form. Sure, all types of stones can lead to challenges and even kidney death, but Struvite stones can be life-threatening if not correctly caught earlier in their formation and managed appropriately. Now, I don't say this to scare you, but to inspire you to educate yourself. The medical system isn't going to come to your rescue, and neither is any miracle drug. There isn't one. And the medical system is happy to have you coming back through their doors every single week, racking up hundreds of thousands of dollars in medical bills while solving absolutely nothing for you. I've met close to 100 people who have been teetering on the border of life and death due to these stones. They have children, husbands, and wives, and throughout their battle, they were convinced that their doctors had their best interest in mind. And while this may be the truth from many medical professionals, all of them are set up to fail because modern medicine doesn't address any of the root causes of disease. Instead, it seeks to treat the symptoms. At the same time, the underlying causes rages on, and the patients get worse and worse, requiring more and more interventions, surgeries, and drugs. So today, I'll walk you through the background on Struvite kidney stones, what specific bacteria lead to these stones, and how you should treat them if you find yourself up against this insidious stone type. So, let's begin and talk about some background to set the stage. So when it comes to Struvite kidney stones, what we're really talking about here is magnesium ammonium phosphate. And this will make more sense in the next chapter where we get into the types of bacteria that form them. But on the surface, this is really kind of what we're talking about with these stones. They can be in a pure form, but they're also going to be potentially mixed with some calcium phosphate stones as well. They are part of that family, and then we talk about how they form in this next chapter. It's going to make more sense how you might actually start to see a little bit of calcium pop up in these as well. Now, this stone type right now is about 10 to 15% of all stones that are formed out there. And back about 5 years ago, 6 years ago, when I really started talking about kidney stones, the data was suggesting that this stone type was around like 7.2%. That's almost like a twofold increase in this particular stone type, and that is terrifying because, again, as we had talked about, these stones can be deadly, and there's a 41% survival rate over a 15-year period. And as I mentioned in the intro, that's like 50-50 shot that you're going to survive these things. And if you have this stone type, you should be absolutely terrified and doing everything you can to try to prevent these, which we'll talk about in the last chapter. Now, this stone type can form predominantly in the kidney, but there's also times where particular bacterial infections will actually colonize in the bladder itself. Now, the bladder type of formation is relatively rare, more oftenly seen in the kidneys, but just know that they can form in both of those two places. Now, this type of stone being deadly, not only does it lead to sepsis, which is the major killer, just that infection that rages all throughout your body, but it can also lead to kidney failure as well. And I've met countless individuals over the course of the last 10 years that have had one kidney die because of Struvite kidney stones, and they're on their last kidney, and they're dealing with Struvite kidney stones in their other kidney. That is a horrifying situation to be dealing with. So if you don't address it appropriately, this can be a really, really big deal. Now, this particular stone type is caused by urease-producing bacteria. Now, we'll talk about this in the next chapter again, but this is a specific set of type of bacteria that actually do something inside your urine given the right urine environment, which is alkaline urine. And it's interesting, as we talked about previously with other type of UTI type of infections dealing with calcium phosphate stones as we kind of wrap up this series. But the bacteria that we're talking about here actually create the alkaline urine environment that sets them up to just propagate and crystallize and like go crazy, just like it's a bonanza. So fixing these things that we're going to talk about in the last chapter is super important, because if you can get your urine pH under control, you can effectively slow down and even kill off these bacterial cultures that are causing problems. Now, the other piece of this puzzle is these are more common in women. It's about a ratio of 3 to 1 right now, but I would imagine that that is likely going to continue to rise because of the prevalence of vegan diets and the vegetarianism that is kind of sweeping the world. And the World Economic Forum, the World Health Organization, all those one government type of organizations are pushing more and more plant-based and more ultra-processed foods, which just sets people up for these alkaline urine environments and a whole host of problems, including kidney stones that fall into that calcium phosphate family. Now, in the next chapter, we're going to dive into the specific types of bacteria that lead to these formation of stones and the specific mechanisms behind those crystallizations that lead to struvite. All right, so welcome back. Now we're going to talk about the specific bacteria that lead to these types of stones forming. Now, there's a whole long list of these, and this is by no means exclusive, but these are the general ones that are going to be found, and they may not mean anything to you on the surface right now, but as we'll look at in the last chapter, when you're talking about doing a urinalysis and a specific bacterial culture comes back to you, I talked about in this, the introduction to this, to empower yourself, to take your care into your own hands, because I can't tell you how many times where, these particular bacterial species have popped up in a urinalysis or a bacterial culture from somebody, and you're relying on another human being who is fallible. They are not perfect, nobody is, and they might miss it, or they might not understand the true implication of seeing these type of bacteria in your urine and what it can mean for somebody who forms kidney stones. So you really need to understand and educate yourself on, I see these names, and I know that these can potentially be problematic for me if I form kidney stones. So, some of the different families that we're going to come across. So there's Proteus vulgaris, Retgeri, Mirabilis, and Morgani, Providentia alcalphanaceus and Stuarti, Klebsiella pneumoniae, Pseudomonas aeruginosa, Serratia, Marsens, and Leucofascians, and Enterobacter aerogenus. Now, again, those names, there's a lot of big old mouthful of different bacteria there. But again, these are the ones that you're looking for on a urine culture if you have or you suspect you have a kidney stone. And these should come out and they should just be jumping off the page, just like flashing lights with like alarm bells and warning whistles going off. These are potentially problematic and you don't want to take these lightly. And we'll talk about that in the next chapter more. Now, let's talk about the actual mechanisms by which these stones form. So I had mentioned that these are urease-producing type of bacteria, and urease is a type of enzyme that acts on urea, and these are also known as urea-splitting type of bacteria because urease acts on urea, which is a component found in your urine just naturally, and it splits it apart. So urea splits into ammonia and carbon dioxide. Now, on the surface, this isn't necessarily a problem, but as I had mentioned previously, this stone type requires alkaline urine, and the bacteria actually create the type of environment, the alkaline environment, that they need to be able to just form like crazy. So the ammonia acts as an alkalizer, so that brings urine pH up to a pH of greater than 7. And when that happens, the ammonia reacts with water from your urine, which is very prevalent, and it actually forms ammonium. Now, I know that this is kind of getting a little bit into the weeds here, but this is an important piece because when that occurs in the environment of a urine pH that is increasing or becoming more and more alkaline, what happens is magnesium and phosphate ions in the urine precipitate, meaning they come out of solution and they supersaturate to become available to bind, and then they bind with ammonium. And when that happens, you get magnesium ammonium phosphate stones, also known as struvite stones. So this is the exact mechanism that takes these stones from just ions floating around in your urine into an actually potentially deadly weapon against you in the form of a struvite kidney stone. Stick around for the last chapter. We'll talk about diagnosing them, treating them, and also what you can do to prevent them.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
Alright, so as I had mentioned previously, catching these stones early is significantly important. And what I mean by that is whenever you start to get those initial kind of pangs of light pain in your back that would suggest that there might be a stone that would be creating a blockage, or potentially you just get an ache in your back because struvite stones tend to form into staghorn stones. And what I mean by that is all those little pyramidal type of calluses that are, make up the interior of your kidney. the stones grow into those, and they kind of look like the rack of a stag or of a deer or an elk. And what you're going to feel is just a lot of stiffness and kind of a consistent low-grade pressure that you might feel. And anything that feels abnormal like that should be a signal to you that probably time to go in and try to get some medical imaging. Now, fortunately, these stone types are identifiable on all medical imaging types. Doesn't matter if it's a CT, an ultrasound, or an X-ray. Now, there are different levels to that. A CT is going to see that stone type way more clearer than an ultrasound would. And an X-ray is pretty good, but again, we're only dealing in 2D, whereas with the CT scan, it's a 3D model, much more incorporated. The CT scans are the gold standard. However, they come with their own consequences. If you want to learn more about the imaging modalities that are for kidney stones, we've got a video that we'll link up with a card here. Now, once you've kind of understood that maybe there's a problem, one of the first things that your doctor's probably going to do is have you do a urinalysis to try to see what's happening with your urine. And the things that we're going to be looking at here, and specifically, is urine pH. So if your urine pH is anything above 7, alarm bells should start going off for you automatically, because that's a potential situation for any type of calcium phosphate stone. The next piece of it is understanding if there's any presence of an infection. And this will, again, typically come back. You might be labeled under a UTI, but on that previous screen that we had in this last chapter, you're looking for any particular culture that fits into those, because those are the offending categories or families of bacteria that will split urea and cause the formation of struvite kidney stones. So that's very, very important. And then there's also some laboratories will start to investigate crystal structures if they do pick up crystals in your urine. And this is kind of a sick joke by nature, but due to the high mortality rate of these stones, it's really curious, but the crystals actually look like coffins. Again, really sick joke by nature due to the death rate that's associated with this, but they're very, very easy to identify because they literally look like a coffin. It's a little bit eerie. Now, unfortunately, if you do find yourself that you have the presence of those bacteria, you do have a stone, surgery is going to be required. This is not a stone type that you want to try to screw around and pass naturally. As much as you want to try to avoid surgery, and as much as I commend you on that particular interest, this is not something you want passing through your urinary tract. Because as the stone passes through your urinary tract from your kidney, through the ureter, down into the bladder, then out of your urethra, everywhere along the way, it's depositing those bacterial cultures of those offending bacteria, which can then lead to sepsis, kidney death, and ultimately, potentially, your death. So you want that stone removed from your body as quickly as possible, and it is pretty much a scorched earth policy when it comes to trying to attack these stones, because you need to kill that bacteria. And your doctor is probably going to use a whole host of very, very powerful antibiotics through this process, which is probably going to leave you feeling very, very sick because they're not targeted. It's not like a, specific strike to an area just to your kidney. When you take those antibiotics, it's going to completely nuke everything in your entire system. All of your microbiomes are pretty much going to die off to the level of power that these antibiotics use. But the unfortunate thing is you're going to probably have to use several of them, because most of those strains that we covered in that last chapter are antibiotic resistant. And I say that with a caveat: pharmaceutical antibiotic resistant. And we'll talk more about in that in just a second. But nevertheless, most of the stuff they're going to use in surgery is not necessarily going to be effective. So, but you do want to have those stones removed, and the surgery procedure that they use for that is a percutaneous nephrolithotomy, also known as a PCNL. And if you're curious to learn more about that, we do have a video talking about the entire scope of what a PCNL is. Now, just for a brief summation though, basically what they're going to do is they're going to puncture a hole into your side, depending upon where the location of those stones are. Kind of will determine where the hole gets placed, or multiple holes. Now these are called access tracts because they actually use a access sheath, which is a piece of silicone or hard plastic that they insert into the kidney through your skin to be able to get the tools in there to look around, and then most importantly, remove that stone so that it doesn't impact the rest of your urinary tract, because that's really, really important to be able to kind of taper off all those things. You do not want this entering your urinary tract, and you want to get it out of your body as soon as possible. So this is what's recommended for removing those stones. Not a ureteroscopy, not shockwave lithotripsy, none of those, because that means all those fragments are going to pass through your urinary tract. Whereas this, you go in, they see it, they remove it, it's out. Doesn't mean that all the bacteria is gone, but that the offending stone is gone. Now, one of the biggest things that you can do to try to set yourself up for success here, and this is what most people don't really truly understand when it comes to kidney stone prevention, that a stone like this is pH dependent. And so much of what we're eating today and what the government and what all the health organizations are trying to push with this plant-based agenda and ultra-processed food, I think their goal is like 80% of our diets becoming from ultra-processed foods. You know, this sets up an alkaline urine environment, and this is the wrong direction to go. And again, there's this whole craze about alkalizing your body and all this and that and stuff. It's all marketing. It's just a bunch of garbage. So you want your urine to be as close to neutral, maybe even on the slightly acidic side. The more acidic you go, you get more problems with like uric acid stones and calcium oxalate stones. But just, you know, a decimal point or two away from neutral, right at 7 or at 7, is generally the place you want to be, because those bacteria that we talked about, they cannot survive in the neutral to acidic environment. They require alkaline urine. Now, the other piece of this puzzle is that you can get there, but you need to closely monitor it, especially post-surgery, because these bacterial cultures are extremely strong. They will come back as soon as they get a chance to. They'll lay dormant, and as soon as the urine alkalizes, even just for a short period of time, boom, they're back in business, setting up shop, and they're starting this awful process all over again. And this is where you get people who have one of their kidneys die. They think it was removed. The doctor said we're all good to go. And then a couple months later, oh, here we go again. Another problem, another kidney stone. It's infected and it's worse this time, and that kidney is dead. And now they're looking at, oh, I got one kidney left, and well, potentially if it is able to travel through the urinary tract, it might migrate back up through the other ureter into the other kidney. I've seen it happen a number of times. It is extremely scary. So you need to, again, take a scorched earth policy towards this, not only from a medical perspective, including antibiotics that they would prescribe to you pharmaceutically, but also from a more holistic perspective as well. So one of the biggest tools that you have, and I talk about this all the time, is diet. So an animal-based diet consisting of mostly meat, dairy, you know, a little bit of fruit, honey, cheeses and things like that, or a strict carnivore diet is going to set up your urinary parameters or your urinary pH to where you want it to be, so that you can minimize as much of those bacterial colonizations as you possibly can. Now, the other piece, again, as I mentioned, you got to maintain this. And I always encourage people to use like pH test strips on a regular basis. You don't have to go crazy. You don't have to do it every hour, but you know, once or twice a day to gauge where you're at. You know, this is a really, really important piece of this puzzle. And very soon we're going to start offering urine strips at an insanely cheap price. I've found a manufacturer that I'm going to work with, and we're going to be able to provide these to the marketplace at such a stupid low price. I'm not looking to make any money on it. I just want to get the tools that people need into the hands of the people that need it as quickly as possible. So we're going to have those here in the next few months available. So be looking out for that to be able to test your urine. And this isn't just for Struvite kidney stones, but all kidney stone types that are pH dependent, calcium oxalate, you know, calcium phosphate stones, uric acid stones. You know, those are all pH dependent. And if you can control these things, you can control a lot of their formation. Now, the other piece of this puzzle is natural antibiotics. So things like Colostrum, which is mother's first milk. This is like an immune booster, and there are a lot of companies. One of my favorites is Heart and Soil. It's founded by Dr. Paul Saladino, who is, I look to as, kind of like an unofficial mentor. He's taught me so much about what I know about diet and preventing kidney stones. I cannot thank him enough for his book and all the information that he puts out to the world free of charge. If you haven't checked him out, you need to go check him out. But nevertheless, he sells a colostrum product from grass-fed and grass-finished cows, and I think it's absolutely outstanding and should be incorporated into your diet if you're suffering from struvite stones. Now, there's also herbal side of this thing, and this is andrographis paniculata. This has been shown in studies to be as or more powerful than the most powerful antibiotic provided from like a synthetic or a pharmaceutical grade without a lot of the negative side effects that you get with a typical antibiotic. So this can prevent infection and deal with sepsis, and it is extremely powerful. However, it is a little bit difficult to find, but it is out there for you to find. So If you're suffering from these kidney stones, do not play around with this. This is no joke. Your life may be at stake. Maybe not now, but someday down the road, if that culture comes back and you have these, again, repeatedly over and over again, because they form very, very quickly, you got to get your diet under control, and you got to start also doing some of the preventative type of stuff in anticipation of trying to keep these bacterial cultures at bay. Otherwise, you're not in for some really good news. So, hope this makes sense, and if you have questions, please reach out to us on the website. Are you spending thousands of hours of surgery just to end up with another kidney stone a year later? Learn everything you need to know to say a big you to your kidney stones inside our free community at kidneystones.com.